Hello friends, welcome to Creative Medicine. In this lecture, we will learn about Lallo, who is a 40-year-old male, has recently started writing books. But the matter in his book could not be understood by anybody else because it contains words which were never there in the dictionary, and the theme was very disjoint. Nowadays, he has become very shy and self-absorbed. When he addresses people, he speaks about metaphilosophical ideas. So, what is the diagnosis? First, he writes books and his books contains the words which were never there in the dictionary. That means he is creating new words called as neologisms. Number 2, he is the theme is very disjoint. The theme is very disjoint. That means the organization of the thought is not proper. So here the patient has formal thought disorder. Then the patient is shy, self-absorbed. This being shy and self-absorbed tells us that the patient has negative symptoms. So all these will point towards the diagnosis of schizophrenia. Neologisms, formal thought disorder, and negative symptoms are seen in schizophrenia. Thank you, and thank you for watching.